Today, we're jumping into a clinical pathway for something called antenatal renal pelvic dilatation, or RPD. Now, this is actually one of the most common things found on a pregnancy ultrasound. And I know hearing any kind of diagnosis can sound a little scary, but we're going to walk through the really clear, structured plan doctors use to handle it. So let's get into it.
For any parent-to-be, the ultrasound is just this incredible moment, right? It's pure excitement. You're getting that first real glimpse of your baby. But every now and then, the sonographer points something out that you weren't expecting, and suddenly, all that joy gets mixed with a big dose of worry. And that's usually where this story begins.
So what is RPD anyway? Let's clear this up right now. The renal pelvis is basically the little collecting funnel in the middle of the kidney. It gathers up urine before it heads down to the bladder. Dilatation just means it's a bit swollen or wider than it should be, usually because urine is backing up a little. Honestly, you can think of it like a temporary traffic jam in the kidney's plumbing.
All right, so here's how we're going to break this down. First, we'll talk about how this is even spotted on a scan in the first place. Then we'll cover the watching and waiting period during the pregnancy itself. After that, we'll jump to the big decision that has to be made right after birth, which leads us to the 4 main pathways for care. And finally, we'll wrap it all up with the big picture.
So let's kick things off at the very beginning. Where and how does this condition actually get identified? Well, it all starts in a place that's probably very familiar to you. The thing is, this isn't found through some scary, specialized test. RPD is almost always flagged during that routine 18 to 20-week anomaly scan. You know the one. It's where you get those first amazing profile pictures and maybe find out if it's a boy or a girl. It's just a standard part of the checkup process.
During that scan, the sonographers are looking for some very specific clues. First, they measure how wide that little funnel in the kidney is. That's called the anterior-posterior diameter, or APD. They're also checking to see if any other parts of the plumbing, like the ureters, look swollen, and they'll take a good look at the bladder too. It's all about putting together a complete picture of what's going on.
Okay, so they've spotted it. Now what? Well, for the rest of the pregnancy, the game plan is all about careful observation. This is what we call the watching and waiting phase.
Now, this is where it gets really interesting. Doctors classify how severe it is based on these millimeter measurements, but look closely. The numbers for what's considered mild actually change a bit from the 20-week scan to the one around 32 weeks. And that's so important because it shows that a little bit of swelling can actually be a totally normal part of a baby's development.
But, and this is a big but, that one measurement, it's really just the starting point. To get the full story, doctors have to look way beyond that single number and check out the entire system for other important signs.
And this slide really shows you what else they're looking at. They're asking all these other crucial questions. Is the actual kidney tissue getting thin? Is this happening in just one kidney or both of them? Are the tubes leading down to the bladder also swollen? And does the bladder seem to be emptying like it should? All of these clues help predict what's going to happen next. All right, let's fast forward. The baby is born. Now we hit the next critical phase, and this is where the first major decision in the whole process happens. You might be wondering, why another ultrasound? Well, once the baby's here, they can get a way clearer and more accurate picture of the kidneys and all the plumbing. This postnatal scan is absolutely vital, and it's the thing that decides everything that comes next.
And this is it. This is the big fork in the road. Based on that first scan after birth, the path splits in two. If there are urgent signs, we're talking serious swelling in both kidneys, or really severe swelling in one or any other major issues, that triggers immediate action. But for everyone else, it's a non-urgent path that involves more careful watching.
So that fork in the road leads us right here, to the heart of this entire clinical pathway. 4 distinct, structured plans, each one tailored to exactly what the doctors are seeing in that specific child. Let's start with the most urgent category. If that postnatal scan shows the renal pelvis is dilated more than 15 millimeters, well, that's the trigger for pathway number 1.
In this situation, things get moving pretty fast. A special scan called a MAG-3 is set up right away. This one doesn't just look at size, it checks how well the kidney is actually working and draining. A pediatric urology specialist gets involved, and if that scan shows a real blockage, they'll start talking about what to do next.
Now, for the moderate cases, those between 10 and 14 millimeters, the approach is still really proactive, but it's not quite as immediate. That MAG-3 scan to check function usually happens at 4 to 6 weeks old, and if the doctors think urine might be flowing backwards from the bladder, which is a condition called reflux or VUR, they'll order a different test called an MCUG to check on that specifically. And now for the most common outcome, which is great news. If the measurement is less than 10 millimeters, the plan is really straightforward. Any preventative antibiotics are stopped, the baby gets another scan in about 6 months just to be safe, and if a few scans show that everything is stable and there are no infections, you're discharged. In most cases, it just gets better all on its own.
Finally, there's one more specific pathway. This one's for a condition where one kidney just didn't form correctly. It's called a multicystic dysplastic kidney. Here, the focus is all about long-term observation with scans at 1 and 2 years old. And what's really important is keeping a close eye on the other healthy kidney because it has a slightly higher risk of developing a problem down the road.
So we've gone through all the pathways, the measurements, the acronyms. Let's zoom out for a second and just look at the big picture. What's the whole point of a super detailed flowchart like this one?
You know, when you first look at the full diagram, it can seem incredibly complex, almost intimidating. But that complexity is actually its biggest strength. The real goal here is simple: to take a situation that feels really uncertain and apply a clear, proven, and structured plan. It makes sure every single child gets exactly the right amount of care, no more, no less, at exactly the right time.
So, what's the final thing to take away from all of this? It's that even when an ultrasound shows something you weren't expecting, there is a map. A clinical pathway like this isn't really about millimeters and scans. It's about turning uncertainty into a clear, manageable, and, most importantly, reassuring process.